today I'm going to touch a little bit on quad stretching, especially early on after your ACL surgery. When we're talking about getting our bending back, our flexion back, there are two areas we focus on. One is the joint itself, right? So that's the knee joint. So we're trying to move it repeatedly, consistently to make sure that the joint itself is moving. Having full motion is making sure the muscles have proper length. I've seen people try to do it stomach side with a strap. I'm going to show you a standing version that I feel like is my favorite, easiest to do early on after surgery, and it doesn't make it trickier to use a strap. As you feel more and more comfortable with your bending, you're going to elevate that height. So you'll go from that stack of books to, let's say, a step at home, which is anywhere from 6 to 8 inches. And once you feel good about that, you'll go to 12 inch. And then finally, a chair that I'm sitting on could be around 20 inches high. And once you get, you're going to feel more and more comfortable with the knee, the way that it's bending, and then using a strap. I utilize this early on, say a few days out, 1 week out, where yes, you're bending the knee, working on that joint movement, right? So as I touched on earlier in the video, bending the knee in the joint itself, working on the kneecap mobility, but the other flip side of it is the muscle itself. And the quadricep muscle is going to be super tight early. So we have to find ways to do it, and we have to find a way that doesn't make us uncomfortable and vulnerable. And for me, that standing stretch is my absolute go-to stretch. Use that early on and then aggressively build up to the levels that you want. And then once you get comfortable enough, you have some good bending. There are much more other variations that we can utilize there.